My name is Dr. Ben Thompson. I'm an audiologist. I am based out of California.
One of the things you touched on is the dismissive and fatalistic messages that medical professionals state to people who are in a very anxious, desperate, sleep-deprived state, as you're well aware. I'm wondering what you feel is your role or mission in better educating other ENTs, primary care doctors, possibly other audiologists, to be mindful of the pronouncements that they make. And I'm guessing that, and I've heard the messages, and several of the people who are with us tonight have certainly heard those kind of pronouncements that you refer to. That someone listens, takes in these messages, and yet persists and refuses to accept that this is a situation of hopelessness, a chronic problem that will never improve and will only worsen. These are obviously damaging messages. So what do you feel is your role in better educating your collegial professionals about how they respond to people?
Thank you so much, Ken. Yeah, my role in this is to be on the forefront of education and raising awareness and sharing case studies of how this changes. So speaking to patients, speaking to the tinnitus community, I want to share these stories of real people and actually have them share it for themselves, because there's nothing more powerful than seeing it and hearing it in someone's eyes, in someone's voice, that they did get better, right? There's nothing more powerful than that. To a professional, we need to speak in medical terms. So there's a psychological process called negative counseling, which intensifies the limbic system reaction and the stress and anxiety response of tinnitus. So scientists and doctors, they think very much cause and effects. So when I can explain, when you tell a patient there's nothing they can do, that creates an effect called negative counseling. Negative counseling is creating unnecessary prolonging of the symptom or intensifying the response of the activated limbic system and nervous system. So in order to mitigate the immediate worsening of tinnitus, refer that patient to someone who knows how to better communicate that. And that's what I'm here to do. I can be that person. There's many qualified audiologists who are that person. And it's a pain point. It's a pain point. I learned that with Dr. Jastreboff, that negative counseling is one of the main reasons why tinnitus can go from it's there, I hear it, I don't know what it means, I'm a little anxious about if something's wrong with my ears or my head. Suddenly, it's a lot louder and no one can help me, and it creates this negative feedback loop. So thank you for asking. It's a good question.
Negative counseling. I would add to that a descriptor of disempowerment. I appreciate, and I'm sure that people that are tuned in with us also appreciate the comprehensive way that you address the problem of tinnitus as an individual, sometimes or highly individualized situation. One size, one case study, one profile does not speak to all. So thank you for your work, and whatever you can do and whatever contribution, this recording serves to better educate fellow practitioners, to ask, to explore the questions that you pose. I think a lot of people will the practice, the intervention will greatly advance. So I salute you for the work that you're doing, and the potential influence for your collegial professionals.
Thank you so much, Ken. I appreciate it. I really take that humbly. Thank you.
So my tinnitus is pulsatile, and I'm curious if is that in the same category as tinnitus, or is it considered more structural, or what's the thinking?
Mm-hmm. Yeah. Well, I want to preface this by saying thank you for asking that question. And I feel that the question and answer in this capacity, it's from your side, it's best kept simple because this is not the time to go deep into any of our individual histories. So thank you, and I hope that's okay. And pulsatile tinnitus, this is not my specialty. This is something that I definitely work with patients around. I am not the end of the road go-to person for pulsatile tinnitus.
Yeah.
In San Francisco, we're very fortunate to have a pulsatile tinnitus clinic where, and a lot of doctors don't even know this, but at UCSF, there's a pulsatile tinnitus clinic, and they're bringing in perspectives from cardiology, otology, the ear, neurology, the brain, talking about the arteries, about ear anatomy, and sometimes we don't find a specific cause to the pulsatile tinnitus.
Mhm.
And when we're shifting from can we diagnose a cause into how do we best manage and reduce that, then a lot of the same principles that you heard tonight are very relevant. I hope that answers your question and helps you a little bit. And please do reach out to, and don't stop your pursuit in getting answers and getting help from this.
Okay, thank you.
Next person, please just speak. Yeah.
Okay, I was wondering, the sound therapy, is that something that's covered by insurance? Usually?
So it's a good question for an audiologist to ask to review your hearing test and review your insurance. And it depends, right? It depends. If your hearing is completely in the normal range, then ear level sound generators would be the best approach for having consistent sound therapy that travels with you on your ears. If you have a degree of hearing loss, then ear level sound generators, or what are called combination instruments, which are hearing aids programmed for tinnitus sound therapy, those would be applicable. And it depends a bit. I advise asking your audiologist. Some insurances will apply to ear level sound generators. Other times, if you have any degree of hearing loss, it can be billed as a hearing aid, and then an insurance benefit would apply to that.
Okay. And so the work that you would do, oh, maybe it's the retraining therapy. Is that covered by insurance? Or, so when I go to my audiologist, they just tell me, what degree of hearing loss and how much it's changed, but they don't talk about specific things I can do or options like you're talking about. I saw some of your videos on YouTube, and I don't know if there's a way to get education out of them, or if it's only through certain programs. Or
Good question. Not all audiologists are created equal in terms of their experience or interest in helping tinnitus patients.
True.
How do you find the right audiologist who is well trained in what you're looking for? It's not as easy as we would hope. The American Tinnitus Association has a provider list, and I'm on that list, and I pay a membership to be on that list, but there's no guarantee that I've actually done any training for tinnitus. So that is a little misleading.
Yeah.
Dr. Jastreboff, the founder of Tinnitus Retraining Therapy, on his website, which is quite old, and if you go on there, you'll think, how can this actually be a real trusted source? Because it's a website from, I think, 1998, but it is updated with providers who have been personally trained by them. Essentially, finding the right provider for tinnitus involves finding local audiology clinics that offer tinnitus retraining therapy,
okay.
and asking them questions of, where were you trained? What experience do you have? Making a decision in that regard is the best way forward at this time. So trying to find the most highly skilled professional in your local area will take a little research. And if you wanted a second opinion on that, you can reach out to us and we can help.
Thank you.
You're welcome.
I have a question on the sound scale, 1 to 10. First of all, how is it defined? How is it measured? And can you measure it at home?
The tinnitus sound scale is subjective. There are research groups who are trying to determine a an objective way to measure tinnitus intensity, but something very interesting happens in the world of tinnitus, where if I ask you how loud is your tinnitus, you can say 3 out of 10, but it's affecting your life more than any other health condition that ever has. And I can ask someone else, how loud is your tinnitus? And they can say 6 out of 10, but I rarely think about it. Only when I'm tuning in do I hear it. The subjective loudness scale is mainly used, from my perspective, as a quick check, and especially for pre and post treatment or therapy outcomes. All of the research for tinnitus is based on subjective questionnaires. That's because it's not only an auditory phenomenon, that actually the biggest drivers of sustained loudness tinnitus are from the limbic system and the autonomic nervous system, and at times the auditory centers as well. Thank you so much.
Ben, excuse me. Some of you have your hands raised. Would you please raise your hand if you do have a question? And let's see if we can get, Ben can respond to some of you that have had your hands raised for a while.
Should we go lightning round, Ken?
Why not? Whatever that means, why not?
Judith, you've had your hand up as well. Go ahead and ask the question.
Yes, hi. I'm from the Dallas-Fort Worth group, and I'm wondering, that was a fascinating presentation. Thank you. But what about us chronic sufferers? I've had mine about 15 years. Is there hope for us? And mine has actually changed a little, and there are days when I have a new sound in one of my ears. Is there hope for us? What can we do, those of us as long-term or chronic tinnitus sufferers?
It's a great question. Thank you so much, Judith. My answer, honestly, is we don't know until we try. I personally cannot say that I've guided people through big changes to their tinnitus after having it for more than 5 years. And that's me being as honest and transparent as possible. That I don't want to overpromise. I certainly want to give hope that if someone can change their tinnitus after 1 year, 2 years, it's the same brain, it's the same body, it's the same human that in theory can use the same principles and potentially make more marginal gains, but still hopefully improve. I hope that helps answer your question.
Oh, thank you.
Ben, if I may.
Please.
I had my tinnitus onset occurred in the beginning of 1996. So I'm a long-termer as well. And the simple answer from my experience to your question is yes. There is hope. And there is progress that we can make. And
Ken, would you say the way to do it is any different than what I laid out worked for those other people in general? What would be different in my experience is that it was more trial and error, as is the case for most people. Had I had the counsel that you offer back then, there would have been less trial and error. There would have been more targeted selection of modes of intervention. So like most of you, I presume, it has just taken time of experimentation. And what impresses me about the case studies that you mentioned, Ben, is the timelines that people were able to reach adaptation, sufficient adaptation and a normalization of their quality of lives in a relatively short spaces of time. That is just phenomenal. So long-term, recent onset, yes, there is hope with guidance and I like to say proactivity, be willing to investigate. And you also mentioned something very important, Ben, around not becoming tinnitus-centric. There's a difference between, and it's a fine line perhaps, of being educated about the condition and how you might learn to manage it, and being obsessed with getting rid of it. So again, here's where here's where Ben's counsel and Amy's as well, I know from her practice, is extremely helpful for us to walk that
if you will, the tightrope.
And
Go on with questions.
yeah, please, next question. And Amy, feel free to chime in. And it's good to meet you, Amy. Anyone have a next question?
Connie has her hand up. You can go ahead, Connie.
Good evening. I'm pretty new to tinnitus a couple months ago. Do you have any suggestions for sleeping? I have a very difficult time falling asleep, even though I have a sound machine. So any of your suggestions would be very much welcome.
May I ask a quick follow-up? Why is it hard? Is it hard to fall asleep or is it hard to stay asleep?
Fall asleep.
Okay. The way I typically approach this is getting the physical body tired during the day is a good idea. And then for an hour before you try to fall asleep, have a wind down routine where there's no screens, no technology, nothing stimulating, no evening news, no movies. Self-care. Wow, you want me to take care of myself in this modern world with all that's going on? Yes, yes. You know what that is for you. And if you don't, it's probably slowing down and doing less and creating the environment that's supportive. Additionally, having a consistent time that you're going to sleep at night helps. Please, anyone else chime in if you have something to add.
But isn't it when it's the quietest is when it's the loudest? That's what I'm discovering.
Well, you please have constant sound therapy. You're early in this, right? Your brain can change. Your brain can change, and using constant low-level sound therapy should replace being in quiet.
Can you explain to me what is low-level sound therapy? I'm brand new to this, so I don't know these terms.
Yeah, you have a sound machine, correct?
Yes.
It might be a simple one. It might be a high-quality one. For example, a high-quality sound machine runs no more than $100, and you can have low-level white noise, pink noise, different kinds of noise, river sounds, crickets. You want that around you if it's through a machine all the time, especially in a quiet place.
So I think you use the term sound generators. Is that different or is that the same?
That's different. Those are typically worn on the ear level sound generators, or if you have hearing loss, they're called combination instruments or hearing aids. Yeah.
How would one go about getting sound generators?
Get a hearing test, consult with an audiologist that you trust, who's well trained, and they'll help you.
Thank you.
Yes, thank you.
Ben?
Yes, hello.
Hello. Would you recommend a hearing aid manufacturer?
No, I would recommend an audiologist over a hearing aid manufacturer. Any good audiologist can make any good hearing aid work for you.
I have a quick question. You mentioned the woman who had, or the person who had COVID injection, and I actually have had a lot of worry about that. And I'm wondering if, you mentioned a Facebook group, and that, I am concerned about side effect like that. I haven't had the vaccine, and I'm just I realized there were some symptoms that probably aren't being widely announced. And any comments about that issue?
Yeah, my comments are that most people who I know who have tinnitus, who got the COVID vaccine, are completely fine.
Okay. And was there any, did they go towards one or the other, or?
I don't have any opinions on that.
Okay.
I obviously it should be studied, but my advice on this is to really think about the pros and cons. It's a pros and cons decision. When you go to a doctor and you say, I'm considering a procedure, they say, well, what are the pros and cons? What are the risks and benefits? What are the risks of what are the risks and benefits of being vaccinated?
Right.
It's rare tinnitus would spike and stay worse. As you probably experienced, you have a bad day, someone honks at you on the highway, your tinnitus spikes for 2 days. But is that worth risking your actual health and risking getting COVID, that's a very personal decision. Unfortunately, I don't have to make that for all my patients.
Okay.
but it's an effect. It's not enough to deter someone with tinnitus to avoid the vaccine at all costs. It's a personal decision. There's not that clear of data to, if you're a data-driven person, to make your decision. And there's a lot of fear and anxiety, and this is a very sensitive thing. So whatever you do, just be as calm and comfortable with it as possible, and accept that either getting it or not, there's some risks and benefits.
Good point. Thank you.
Mhm.
I have a question. Dr. Ben Thompson, you're talking about 3 ways to control over tinnitus. You're talking about sound therapy, medication, and exercise. And I know some people, they take some supplemental, do you recommend it, or you can suggest any supplemental we can take to help us with tinnitus?
Yeah, I'm so glad you asked. I am researching this more and more because it seems to be helping some people, but it's very trial and error, and there's nothing that systematically works for every person. What is a supplement? A supplement is supplementing the traditional nutrients and minerals that you would get from a clean, healthy, balanced diet. So perhaps the better question is, first, let me make sure I have a very balanced diet that covers all of the important aspects of health, and then considering supplements. I'm not a nutritionist. I'm happy you asked, because recently I've realized that I'm planning to hire a wellness coach who specializes in nutrition and sleep and stress to be a part of my team at Pure Tinnitus to help people as a team approach, because this is where the audiologist is not well trained, nor do I necessarily want to be in consulting you about nutrition. You've certainly heard some nutrition supplements being used if you're online, and there's definitely a lot being sold to you. One of the interesting things is that if you take one of these herbal supplements that are sold to help tinnitus 911, I'm not going to talk about them. You've probably been advertised to them and tempted to try them. Look at the ingredients and maybe just have tea with those herbs instead of buying pills. It's a personal decision. Consult a nutritionist because they'll be able to individualize it for you. But I don't recommend herbal supplements. None of the patients I described getting better relate their improvement to herbal supplements.
Thank you.
Yes, thank you.
We do have some questions in the chat as well. From Leon, we have, are there any specific medications that are known to negatively affect tinnitus?
That's a tough question that I won't try to answer. It's a very mixed bag. There are some medications that are called ototoxic, meaning that they hurt your ears, and those should absolutely be avoided if possible, but those aren't standard drugs unless you're taking a high dose of Advil, I believe, every day. But overall, don't worry about medications spiking your tinnitus. If you go online and search, does this medication have a side effect of tinnitus? Almost every single medication has changed someone's tinnitus at some point and therefore will be reported. That's my best answer. It's a good question between your audiologist and your doctor who's prescribing or considering the medications. Anti-anxiety meds, for example, are sometimes helping tinnitus, sometimes hurting tinnitus. So don't be afraid whatever you choose to do, but understand that some medications may change your perception of the sound. And if it does, it's usually temporary, not forever. Ken, you have something to add?
Would you refer people to the ATA website wherein a person can view the different tiers of medications that are suspect or highly probable in creating worsening tinnitus. Would you see that as an acceptable recourse?
Yes, please. I haven't devoted that much time into learning the medication relationships of tinnitus. It's obviously that's a whole field of study in and of itself. The ATA.org list of medications that are safe, that's a good place to go. Yeah, thank you.
Dr. Ben, I told my pharmacist that I've got tinnitus just in case I got prescribed a medicine that was known to be autotoxic. And I don't know if that's recommended. I was just terrified.
That's highly recommended. Yeah, a pharmacist is a very knowledgeable individual who in some cases might advocate for you more than a doctor.
Yeah. And so she has it on my record now. So if I get prescribed something that might be autotoxic, then she's going to let me know and talk to the doctor.
I love it. I never thought of that. That's smart.
Let's see, we have another question on chat. A friend recently got something called Iqbuds and said it has made a great difference for her. Are you familiar with this device?
Yes, actually I have a side project called hearweb.com where me and some other doctors review different hearing aid products, and mainly for hearing loss, because as you might know, well, maybe you don't know, but let me just tell you that more and more quality hearing aids are being sold direct to consumer online for a significantly lower price. So there's a lot of education that needs to happen on would that be a good fit for you. Iqbuds, I have a 15-minute in-depth detailed review about that product. I wouldn't recommend it for tinnitus because it occludes the ear. And for anyone who has treated their tinnitus with hearing aids or sound generators, you know that typically they're what's called an open fit, meaning that it's not occluding the ear. Because what happens when I wear headphones, it's occluding my ear. What happens when I put my fingers in my ear? It's occluding my ear. My tinnitus gets about 20% louder when I do that. Yeah, I'm hearing other sounds coming through the Iqbuds, which are mainly Bluetooth devices, not hearing aids, and not tinnitus devices. So I advise typically not occluding the ears. But if you just wanted to get some good Bluetooth headphones, yeah, those would be a pretty good option, and they might make your tinnitus less when you're wearing them. But in terms of a sustainable plan, it's not in line with the tinnitus retraining therapy protocols. No, nor was it designed to be.
Thank you. Okay,
Yeah.
We have another one. I think it is, well, I think this one is more of a comment. I think it is very important that more psychologists and psychiatrists take the time to learn more about tinnitus and hyperacusis.
Anyone want to comment on that?
I have a comment. In line with that, a question I would pose to you, Dr. Ben, is how do you teach practitioners the art of empathy? It seems to be inherent in the work that you do. Practitioners who experience tinnitus to some degree tend to be more empathic. And one of my mantras to our membership or participants is, if you are dealing with an audiologist, an ENT, a primary care physician who lacks empathy, whether they experience tinnitus or not, you're probably better served to go elsewhere. You're not likely to get the care that you need. And I would hope that one of the things you will emphasize, however you do it, Ben, is to teach your professional colleagues something about empathy and how to come from a place of empathy when dealing with folks like us.
That's excellent, Ken. That's excellent. You're a wise man, I can tell from the way that you've put this together, and you're coming at this from a holistic perspective. Two words coming from that which hit me deeply are empathy and care. health care, my initial thought, which I was almost scared to share because I don't want to make myself seem too esoteric, is that empathy is a form of medicine. That empathy is enacting care, and care is part of healthcare. Now, when I initially heard your question, I thought, before I care about others, I need to care about myself. I need to practice self-care before I can have deep empathy for others. And I don't know how I don't know if my mission is to instill empathy in others. The best way for me to approach this is to share a message of how empathy, kindness, care, attention, and sitting with people's emotions instead of brushing them off to the side or dismissing them helps them in their process. Now, the medical system, the audiology clinics, are not designed to spend 50 minutes with a patient to work through their suffering. That's usually a private practice tinnitus specialist or a psychologist. So it seems like, unfortunately, that's where a lot of people, especially those who cannot afford private services, are left to figure it out on their own. So hopefully my YouTube channel is a way to have high quality information at low cost for those who otherwise couldn't afford one-on-one time. And I'm glad you shared that, Ken. Hope maybe one day we can go on a hike and talk more about these things.
Other questions?
Hi, Ben. There is a question from Arlene about your presentation. She wants to know if you would share the cause of the tinnitus for your case study number 2 and number 3.
Yes. The cause from case study number 2, which was 62-year-old female, retired, had tinnitus for 8 months. The cause is life stressors that are unrelated to the ears. When we look at a close level, usually the ears, the cochlea, have some change from what they used to be. That's all that it takes for your brain to have a low-level buzzy charge that can be amplified and intensified and manifest as loud tinnitus. Typically, it's in case study number 2, it was periods of stress, which I won't get into the specifics. And that's such a general term, stress, but honestly, that's what it was. Case study number 3, the initial onset of the tinnitus was associated with relationship difficulties. There was actually a study done in 1995 which looked at what are the most common factors for the onset of bothersome tinnitus. And number 1 was work stress or retirement, or going on retirement or work problems. Number 2 was interpersonal relationships or conflicts. And only number 4 was acoustic trauma. So it shows you that the primary reasons for when someone develops louder tinnitus are not the ear, but it's related to the ear.
Please hydrate.
I don't think we have any other questions coming up at the moment.
Comment, if I may. Amy Sandy Terrell describes in chat I'll call it a procedure or technique, if you will, that she uses to help lessen her distress from tinnitus. And Sandy, if you're still with us, I trust you are, do you want to comment on that? Do you want to elaborate on what you said?
I just cover my ears with my palms, and then with my fingers, I tap on the back of my head. So I'm like generating sounds inside my head from the outside of my head. And then that helps reduce the intensity. Like Like if my tinnitus is just absolutely screaming and I can't hear.
Thank you for listening. And I hope that these stories encourage you to take this seriously, to stay focused, to follow protocols that are tried and true, and be patient through those tough days. Thank you so much.